Well, hi there, good afternoon. Thanks for joining us for today's Daily Update. I'm Dougal Saunders, joined by Scott McLaughlin, Chief Executive of the Western New South Wales Local Health District, and also Assistant Commissioner Jeff McKechnie, who's the Western Region Commander for the New South Wales Police. Now, I want to start with a bit of a positive today. One I mentioned yesterday is around another little ray of sunshine we've got, which is the ability for public pools to be open from next Monday, September 27. Councils around the region will now be looking at the option of doing that. Now, just to be aware, there will be some councils that won't be able to open pools from next Monday, but those that are able certainly now know that they're able to start preparing. There will be some more information from New South Wales Health around what some of those requirements will be. Council pools will have to have obviously a COVID-safe and a fairly stringent COVID-safe plan in place, but it's again another outdoor area that will be available for exercise, but more details on that coming up in the next couple of days. Up until 8 o'clock last night in the Western New South Wales Local Health District, 10 new cases, 6 in Dubbo, 3 for Walgett, and the 1 case at Cowra that was flagged yesterday, which is included in today's numbers, so 10 overall. Now, there are concerns around that case at Cowra, and based on that, Cowra will be going back into lockdown from 5 o'clock this afternoon, back under stay-at-home orders for 7 days. That also includes anyone that was in Cowra from last Monday, September 13, at any point from that point onwards. No matter where you are now, you are also included in that stay-at-home order for a period of 7 days. So that's a fairly important message, a bit of concern around the infectious nature there. Health District total cumulative 1,073, Dubbo up to 767 in total. Far West today, 2 cases at Broken Hill. Now, when we look at the 11 new cases, 2 infectious in the community, those 10 cases, 2 infectious in the community for more than 2 days. That includes the Cowra case and also at Walgett. 7 have been isolating, 1 still being investigated from that 10. Just over 250 people now are being investigated, are being looked after, I should say, in that COVID Care in the Community program. So we're dropping and getting more people out the other end all the time. So 37 extra people have been discharged in the last 24 hours, which means they're no longer infectious, no longer requiring care. And the total now is over 750 people that have been through that program, which is amazing. Testing, just over 2,700 across the region over the past 24 hours, and about 1,000 of those in Dubbo. Part of the answer has definitely been surveillance testing. We saw a bit of a bump in the last few days since we've seen surveillance testing, but asking you to keep coming forward and doing that surveillance testing, which is a pretty simple thing. It means you can do the test and keep going without needing to isolate if you do not have any symptoms or have any close contacts with people who do. So surveillance testing currently happening at Dubbo, Bathurst, at Mudgee, at Trangie, at Walgett. We know it's at Lightning Ridge. It has been at Cowra as well, Forbes and Burke, and there'll be more news about the possible expansion of this when we catch up tomorrow. But just a reminder, surveillance testing means you can get a test. You don't need to isolate until you have the symptoms, so you can continue going on to work. You do need to isolate, though, if you have any symptoms at all or if you've been a close or a casual contact. So bear that in mind, please. Vaccination, second dose is happening right around the region. Wrapped up yesterday in Dubbo after another 7 days of dosing second doses and doing some first doses as well. Narromine and Forbes both having final days today. Narromine at the Sports and Fitness Centre and also doing some first doses there again, and also at the Narromine Keeping Place, particularly targeting Aboriginal community members and those 12 plus, again available all day today. Mudgee underway today, that's running through until Friday at St Matthew's for second doses, and Golgong underway until Wednesday at the Memorial Hall. Now, just a reminder, I've had a few people querying if I haven't received my text message yet about my second dose, what do I do? Look, you may not have received it yet. If you're due later in the week, it may not come until today or tomorrow. If you don't receive a text message and you know the day you got it last time, your first dose, just go on that corresponding day this time. So you've actually hit that 3-week period and go at roughly the same time you got vaccinated last time and you'll be fine. Take your Medicare card, take some ID, your individual health identification number if you don't have Medicare, and that'll all be good. Now, there is a link on this post as well that'll give you details of all the other towns in the region coming up for second doses, but I can tell you Nyngan starts tomorrow for 3 days and Grenfell's happening tomorrow as well. But have a look at this post and check out your local town for when doses are back in your area. West Haven Clinic, I've mentioned this, it's happening in Dubbo from today through till Thursday. It's now a completely walk-in clinic, so eligibility for everyone. Anyone who can get to West Haven, which is in Hawthorn Street in Dubbo, it's open right now, taking walk-ins literally from anyone. So it's again another way of making sure you're getting a dose. If you haven't had your first dose or you haven't been able to book a second dose, West Haven is one of the really good options there. And the Mudgee Vax Clinic that I talked about had a fantastic weekend of focusing on school children particularly, so those over 12 in the Mid-Western Local Council area, and they did nearly 1,000 doses over the weekend at the Mudgee Vax Clinic, which is extraordinary. A massive thumbs up to all of the people working at the clinic and also all the people, the mums and dads, that made sure you got your 12 plus students into that clinic. So it's looking fantastic for Mudgee and the region as far as that's going. So well done on that. And as far as booking, there is just so much availability of vaccine in our region at the moment. We keep hearing from GPs availability each and every week to book in. You don't have to be a client in most cases at GP clinics. They're taking people that aren't actually on their books to do dosing. And of course the pharmacies, we know Moderna's come in. It'll be arriving in our region this week and dosing starting from in most places next week. Lots of availability, and again, that particular vaccine is suitable for 12 plus as well. So again, if you've missed out on getting children done, a great opportunity coming up. So seek out, there are so many different ways to get a vaccine now. We're doing really well. We just need to keep pushing on and make sure we hit those targets. I'll ask Scott to come forward now and give his health update.
Thanks, Dougal. Good afternoon, everybody. Can I start by passing on my sincere condolences to the family and friends of the lady that passed away in Dubbo on the weekend. I know it's a very sad time and a significant impact not being able to visit and see someone in their last days. It's a pretty timely reminder of the impact that COVID can have on our bodies and the family and friends and broader community impact right across our region. Today's a real example of why we can't relax with a new case in COVID in Cowra that has, as Dougal said, triggered stay-at-home orders for Cowra from 5 p.m. this evening for a full week. It's a case that was infectious in the community over recent days, and so again a real warning that on any day of the week, any street, any shop, there can be someone infectious in our communities. There's a lot of talk about the stay-at-home orders, who can come in, who can go out of them. I just want to reassure everyone there is an expert panel that looks at this, the Chief Health Officer for the state and a range of other experts that are really looking at what's the real risk for communities, what are the need for stay-at-home orders and the things that will need to be in place to help keep the community safe. Now, Cowra is stepping into that for a week period. We know that over the weekend there was huge numbers of people come out and get tested in Cowra, so thank you to everyone that's taken that step. It'll be one of the most crucial arsenals for us in helping to track down where COVID is creeping around our community. Likewise, vaccination is going to be the best solution we've got to slowing the spread and stopping people get really crook. Dougal talked a lot about the opportunities coming up in the forward week for vaccinations, and there's a lot of those coming available. So at 8 p.m. yesterday, 10 new cases across Western New South Wales. That's got 6 in Dubbo. Now, all of those are either household contacts or have been in isolation, so there's some good news there. In Dubbo, there hasn't been anyone infectious in the community. Walgett with 3 known household contacts, and the case in Cowra that has had a person infectious in the community. So there's some positive signs there, but nonetheless a real warning with that COVID, with the Cowra case that has some real risk for the community. Again, updates on the aged care facilities over the last couple of days. We haven't seen any new cases in either of the 2 aged care facilities in Dubbo, so there's some positive signs there with both the rapid antigen testing for staff ongoing and the regular testing for residents in those facilities. There's quite a few of those residents in the coming days will be coming out of the back end of their 14-day isolation period and through their period of illness, and so there's some positive signs there for some of them, for our elderly people in these aged care facilities. The aged care facility in Mudgee, however, does pose some risks. There's been a case identified over the weekend of a staff member in that aged care facilities, and a lot of work has gone on to both test the staff and the residents in that facility, wrap a lot of support and infection control specialist advice around that aged care facilities. We'll keep a very close eye on any further changes to that facility. There's a new venue of concern, obviously, in Cowra. If I can encourage everyone in Cowra to look at that New South Wales Health website with the venues of concern and keep up to date with that. There isn't any new sewerage tests in locations where we haven't got cases. Some positive signs there. Those tests, the vast majority of those locations will be tested today, and so we'll expect to see some more results around the middle of the week. Testing for COVID again over the weekend saw a significant jump in some of our communities, and particularly where we've opened up surveillance testing. And as Dougal said, there's an opportunity for people to get tested where you don't have symptoms. So come and get tested if you don't have symptoms, and you don't have to isolate with that requirement. If you do have symptoms, we do ask that you isolate after the test until you've got the results back. So some increases. Dubbo saw over the weekend 2,680 people tested. However, in both Orange and Bathurst, significantly lower numbers, where we know there has been infectious cases in the last week, 10 days and 14 days. So Orange at 457 over the weekend and Bathurst at 611. Whereas Cowra over the weekend saw 1,070, and that included over 730 people tested on Saturday. So thank you to the community of Cowra. If I can put a call out to encourage people, in particularly Bathurst, where we know there have been infectious people in the community, surveillance testing is available. You don't have to isolate if you don't have symptoms. The mobile at-home testing continues across Orange, Dubbo and Bathurst. Please, if you can't leave your home for a variety of reasons, then reach out to our team who can come around to your home to test you as well. That's through the 1300 066 055 call centre number. The number of patients in hospital and in care in the community, as Dougal said, we've now seen a further positive signs there. More people are getting over their COVID infection. We've now got 18 patients in hospital across the whole of the region, 5 in intensive care and 3 of those ventilated, with 8 in Dubbo, 7 in Bathurst, 2 in Orange and 1 in Brewarrina. We've seen the vast majority of our staff return to the workplace. We've now only got 6 staff off in isolation across the whole of the local health district out of 8,000 staff, and so there's some positive signs there around the capacity we've got to care for our community through our outline. There's a lot of opportunities coming up in the next week and 10 days. Please look out for those today. The best day to get a vaccination is the one you can book in for today. The walk-in and pop-up clinics are readily available right across a number of locations in the region. Importantly, through this week around Grenfell, Canowindra, Yagara and Cowra, right throughout this week with the risk around those localities. Please look out for the vaccination opportunities there. Listen, with that, I'll hand over to Jeff McKechnie.
Thank you, Scott, and good afternoon, everyone. Some really encouraging numbers there, I guess, right across the region, but it's no time for us to get complacent. We've been in this a long while, and there's still a while to go, and we need to keep our focus. Over the weekend showed us that people are trying to do the right thing. Our number of breaches was way down to some of the lowest numbers we've seen already. Some of those additional freedoms around being able to gather in groups of 5 in public places. Saturday was pretty ordinary in terms of the weather, but yesterday was a nice day and we had plenty of people out taking advantage of that. So please, continue to do that, but do it safely. You still have to wear your mask when you're outside. It's only 5 people. Children don't count. But please keep your groups separate, and we shouldn't have too many issues. Certainly a drop-off in vehicle movements between a lot of our locations, a lot of our at-risk locations, but our traffic and highway patrol people are interacting with a lot of vehicles every day. Still too many people moving between our at-risk towns, in particular in the far west of the state. And you know, in lots of ways they are doing it for reasons that probably are close to okay. But really people just need to think about the reasons for travel. If something can be put off at the moment, you know, in a place like Walgett or in a place like Burke or even our smaller places, please think about how you do that, and just put it off for a couple of weeks and let us get through this really difficult time where we're trying to stop the spread of COVID to our small locations. We're having some really good success. People are working with us, working with health. They're doing the right thing. They're staying at home. And we're going to see some of our small towns this week that have had large numbers, you know, come out of that process and have 0 active cases, which will be fantastic for them. So we're really trying to help them as much as we can in that regard by limiting travel. But you know, if it's a job that can wait a couple of weeks, please think about waiting. We're getting our first police officers back at work that were originally came down with COVID, which again is a good thing. Our workforce hasn't been impacted significantly, but just today we've had one of our first cases come back, which is good news, and we just need to be very careful into the future about how we protect our officers and how we protect everyone from people who are positive with COVID. But we're doing a lot of work in that regard. Vaccination-wise, fantastic work from the ADF clinics right across the region. Over 37,000 vaccines now delivered by our ADF teams. We see them heading out every morning to locations across the region. That's going to continue. They're going around giving the second dose now with walk-in for first doses in many places as well. So please, if you see that team in your town operating, take advantage of that and get yourself vaccinated. That's about it from me. I'm happy to take any questions from anyone online this morning.
Thanks, Jeff. Has anyone got questions? Could you raise your little hands now? We've got one from Emily at the Daily Liberal.
Hi, Jeff. Good news about your police officer coming back to work. Just wondering if you had any numbers of how many are still recovering?
I believe that leaves us with three recovering. We had a total of 4.
Okay, thank you.
Thanks, Emily. I think that appears to be it for you, Jeff. Thank you very much.
Thank you, mate. Cheers.
If anyone has questions for Dougal, could you raise your hands now? Just give that a second. But it appears as though you're off the hook today, Dix. Thanks, mate. We'll bring Scott forward. And we'll kick off with Emily from the Daily Liberal.
Scott, is there any update on local vaccination rates across the region?
We expect to see some of the data come out later on today with updates to vaccination rates, but fair to say we've seen a huge boom in the number of people getting vaccinated in the last week that I'd reckon across a lot of the region we'd be pushing well over 80% as an average, and some communities up around 85-90% of first doses, and so there's some very positive signs there. We'll come back tomorrow with some updates on those rates.
Okay, and I guess just in terms of Dubbo specifically, in the overnight cases, you said all household contacts are in isolation, so at this point, no one infectious in the community. How are you feeling about Dubbo at the moment?
I'd say still very cautious. We know that in the last week and 10 days, there's been quite a few people infectious in the community. It was good to see the testing numbers right up on the weekend. I think over 2,500 people tested over the weekend, so that was a good rise. And with the surveillance testing available, that's probably the most crucial thing that we can do to get tested, get vaccinated, and try and keep in front of the spread in Dubbo.
Thank you.
Thanks, Emily. Gary from ABC Western Plains.
Hello. Hi, Scott. The testing result, the testing numbers that we've gotten in Dubbo and some other areas that have had the surveillance testing in place, are you happy with those increases in testing? It seems like it's gone up by quite a bit, especially in Dubbo.
Yeah, it certainly did, Gary, and that was really pleasing to see that with the requirement relieved to have to isolate after testing, even if you don't have symptoms. And I think that has really helped for people coming out to get tested. We saw about a 30% increase over the weekend across all of those locations. We'll come back and talk tomorrow about a further step in surveillance testing across the whole of the region.
Why wasn't surveillance testing introduced sooner? Was it just the capacity wasn't there, or did you not think it was needed?
Yeah, a lot of it has been around the capacity of the pathology system and making sure that we can get results turned around as quickly as possible for people. So it's been a step that we've taken now that we've got a lot of the new fast turnaround testing machines into the region. There's been a lot of investment and new technology that's come in to help turn around tests faster for the whole of the region.
Great, thank you.
Thanks, Gary. Ollie from Wynn.
Good morning, everyone. Morning, Scott. Firstly, I just had a question about the case in Cowra. Do you have any additional information on that case, where they might have contracted it, whether they've been linked to an existing cluster or infection or anything like that?
Yeah, we're still doing a lot of investigation into the case in Cowra. We know it's a child under 10 years of age that has been infectious in the community over a number of days. We're doing a lot of testing, obviously, with the family and other people connected to the case. We don't have links yet to where they've picked it up, and so we're really cautious that this may not be the case that was triggering the sewage testing earlier on. This family doesn't live in Cowra, they live outside of Cowra, and so I really would urge some caution for everyone in and around Cowra. If you've got any signs and symptoms, please, most urgently, come and get tested. Even if you don't have symptoms, come forward and get tested through the week. If you've been tested in recent days and you develop symptoms, please come back and get tested. We really do want to find where the COVID transmission might be coming from.
Brilliant. And just one more thing. With breast cancer screenings, is there any update on how that's going across the region in terms of reopening a lot of those breast cancer screening facilities so that people can go get those really critical tests?
Yeah, we're really concerned about the pause in some of our services that has really had an impact on people's lives. So we do want to look at reopening some of those services as a matter of urgency. The statewide decision around breast screening, I think, was an absolutely logical one, given both the risk around breast screening services. And so we're looking at that closely at the moment. We'd hope to come back later in the week, early next week, with some plans around how we can restart and reopen some of those services.
Fantastic. I really appreciate it.
Thanks, Ollie. Claudia from Prime. Claudia, are you there?
Hi, Matt. Sorry about that. Hi, Scott. Can you guys hear me?
Sure can, Claudia. Yep.
Awesome. Just in relation to the exemption that was given on the weekend for residents who need to sort of cross into a stay-at-home order for supplies or for care, I'm sort of speaking specifically to Cabonne and Blaney residents. Can you define what the necessary supplies actually are?
I think we can take this as the things that are absolutely essential to do. If you need fuel for your car, if you need shopping and food that are essential to your everyday living, those are the things that are okay for you to come into a stay-at-home order area. Also for health-related purposes, if you've got a medical appointment or you need obviously to get to an emergency department or something more urgent. Now, I think everyone can break that down pretty practically. If you don't need to go into a stay-at-home order, you don't go. It's really the absolute essential things that you may need to do. If you do go into a stay-at-home order area, then please take all of the precautions that are going to be crucial. If you need to get out of your car, make sure you've got your mask on, you do socially distance, you use hand hygiene products in those locations and check in with QR codes, whether you're at a service station or a shopping centre, but make sure that that's only essential.
That's me. Thanks so much.
Thanks, Claudia. Bradley from the Western Advocate.
Hey, Scott. Thanks for your time. I just wanted to ask just about the low, compared to a couple of weeks ago, it looks like we've been getting across the Western region quite lower numbers than before. Is that kind of a positive, and do you expect those numbers to still remain low across the region? Did I clarify it was positive cases? that I was talking about, the positive cases we've had?
Yeah, sure. Thanks, Bradley.
Yeah. Sorry.
So, mate, yes, it is pleasing to see some lower numbers, and particularly lower numbers of people infectious in the community. That's the thing that we know where there's real risk around broader community spread. What I would say, though, is around Bathurst, we're very concerned that there has been people infectious in the community in the last week, and the testing numbers are nearly at a record low. And so even with the surveillance testing enabled for Bathurst, we'd be very keen to see those testing numbers double, if not triple, in coming days. So please, if you've been tested in the last week, if you've got symptoms that have come on, please don't leave the house without coming to get tested. If you don't have symptoms, then come and get tested, and it's okay not to isolate in those situations. So for everyone around Bathurst, it isn't time to be complacent. This is time to double our efforts to try and get in front of any other COVID spread in the community.
Yep. All right. I just want to ask one more question. In terms of recovering from COVID, does it still normally take about 14 days? I know Bathurst, we had some cases on the 8th and the 9th of September. Kind of want to know if those kind of cases, have they recovered yet? Does it take 14 days? Does it take a bit longer? Is it a bit quicker? Like, what's the rule of thumb?
Sure. So the vast majority of people do get over their COVID infection within 14 days. But for some people that have got other underlying health issues, whether it's a chronic respiratory or lung condition, heart failure or other things, it may take a bit longer. We know that the infection can hang around in some bodies for longer than others, but the vast majority of people do get over that within the 14 days. The vast majority are being discharged from our Care in the Community COVID program, and so there's some very positive signs there with over 700 people that have now come through their COVID infection.
Yep. All right. Thank you.
Thanks, Brad. Xanthi from ABC Central West.
Hi, Ms. McLaughlin. Just wondering, considering how much case numbers, testing numbers have risen since the introduction of surveillance testing, do you think that it should be available everywhere? And what, if you are planning on expanding it, what towns
Xanthi, we're planning to come back and talk about that more tomorrow. We know that there's been a positive reaction where we've opened up surveillance testing, and we do look to come back and announce that tomorrow.
Okay, and what has to happen in a place like Orange, considering there are a fair few factors at play with releasing towns out of lockdown? In Orange's case, what would have to happen for it to be released from those stay-at-home orders?
Sure. So the rules or guidance around the stay-at-home orders was for a 14-day period of no cases infectious in the community. Now that means that Orange is coming up on that in coming days, and so there's a statewide panel that looks at these on a weekly basis, particularly with any new cases in communities, to assess the scale of risk around those. And it's helping to weigh up some of the other things that will be important, whether it's this sewage testing, the general testing numbers and the likes, just to help us make some well-informed decisions. But Orange is coming up on its 2 weeks without an infectious case in the community.
And just one bit of clarification, just double checking, is this the first case that Cowra has ever seen since the start of the pandemic?
Yes, it is. This is the first case for Cowra and for that region, and so it's been a really concerning time for the community. I think looking at everyone around them, there's been quite a few cases in Bathurst, Orange, Blaney and other communities, and so I think everyone felt as though it was just a matter of time, but really distressing for a lot of people that this is the time to double our efforts. Even in places where we don't have cases, it's a real warning shot over the bow that on any day of the week there can be someone infectious in all of our communities.
Thanks, Xanthi. Alana from the Central Western Daily.
Thanks, Matt. Hi, Scott. Just wanted to ask about testing in Orange. I know that numbers were really, really low last week and you were encouraging people to get out. Has there been much of an increase since this one over the weekend, I should say?
So there wasn't an increase over the weekend. If anything, the testing numbers are nearly at a record low in Orange. We know that with surveillance testing enabled and some other things, that will help to increase it. But I really would encourage everyone in Orange to come out and get tested. If you've got any signs and symptoms, today's the day. Please don't leave the house without coming and getting tested. And we'll come back with further information on surveillance testing tomorrow.
Cool. And I just wanted to ask, it might be a little bit too soon to kind of tell just yet, but since vaccination kind of got so much higher in Orange and you know, across the kind of region, has the severity of the infection in COVID, is that decreased, like the extent to which people need to be hospitalised and that kind of thing?
Definitely, without a doubt, vaccination is starting to have more of an impact in slowing down, I think, some of the transmission, but also helping people to not get as crook as that they might have done without being vaccinated. We've seen a lot of our cases have been in younger people, which we know don't get as crook as some of our older generations. But what we do know is when people need hospital and need particularly intensive care and ventilation, that they're typically unvaccinated, and so that's the real warning sign for us. That you can end up in hospital in a pretty serious situation if you're not vaccinated. So please can I implore everyone, if you haven't had a first dose of vaccination, please come out and get that in coming days. There's a lot of opportunities around. The pharmacies will be starting to vaccinate from early next week with Moderna, which is a very highly effective and safe vaccine. It'll be readily available through a lot of pharmacies across the whole of our region with good supply, and so it's a perfect opportunity. If you haven't had a vaccine, please look for that in the next week.
Great, thank you.
Thanks, Alana. Andrew from Australian Community Media.
Yes, good afternoon, Scott. Yesterday, the drive-through testing clinic at Cowra was supposed to finish at 3 o'clock, but the staff went hours past that because there was just such a high demand in Cowra, which is great to see. How many days is that drive-through clinic expected to operate in Cowra for?
Sure, so we'll have the drive-through clinic at the showground available right throughout this week, 9 a.m. till 4 p.m. now. We've expended those hours knowing that over the weekend there was a lot of people that really wanted and needed to get tested. So can I say thank you to the community of Cowra for coming out to get tested over the weekend. Please don't hold back throughout this week. We really want to get in front of whether there is any other community spread of COVID in Cowra. We don't have links yet to the case that has been identified where they might have picked it up from, and so we all do need to assume that there can be other people in the community that are infectious, that have got COVID and potentially spreading, and so please can encourage everyone in Cowra to come out and get tested throughout this week. If you've been tested once already, don't let that hold you back. If you've got symptoms that come on, then please come back and get tested very quickly.
Okay, that's it. Thanks, Scott. Thanks, Pat.
Thanks, Andrew. Laura from the Coonamble Times.
Hi, Scott. As you said, vaccination's been really strong over the past few weeks and gained a lot of momentum. Are you satisfied that the take-up for AstraZeneca has been stronger and that we've overcome some of that hesitancy around it?
Yeah, we're certainly seeing a lot of people choosing AstraZeneca. It's a safe and highly effective vaccine. The time frame for the second dose has been shortened for our region, and so there's a lot of opportunity for people to look for AstraZeneca as an option, particularly the over 60 population. So can I please encourage everyone, think about your mum, your dad, your auntie and uncle and friends and family that may not have been vaccinated yet. If they haven't, then today's the day to help them book in. One of the most crucial things for us in this region is to help get our older people vaccinated. We've seen a huge uptake in the last couple of weeks of the number of younger people and particularly the teenagers coming out to get vaccinated now. That's very positive. I don't want to be leaving anyone behind in the region, and so particularly some of our people over the age of 60 and 70, it's the most crucial thing that we can do is help them get vaccinated now.
Great, thank you.
Thanks, Laura. Glenn from SBS.
Hi there. Just a quick clarification, if I can, please, Scott. The numbers in Western New South Wales LHD, was it 8 with 6 in Dubbo?
No, mate, it was 10 with 6 in Dubbo, so 10 in total.
Thank you very much. And 3 in Walgett, is that correct?
Yes, that's right.
Thanks very much. Nothing else. Thanks, mate.
Thanks, Glenn. That's everyone, so we'll call it a day there. We'll get the recordings out as soon as we can. Thanks very much for attending.
Thanks, everyone.
Thank you.
Thank you.